Now, let us see how an automated external defibrillator works. The advantage of an AED is that you don't have to worry about recognizing a shockable rhythm. Automated external defibrillator or AED is a device that analyzes the rhythm and assesses whether the patient needs a shock or not. If the rhythm needs a shock, then machine gives you a prompt to press the shock button and the shock will be delivered. Let us now summarize the steps to operate an AED. Turn on the AED. To do this, you have to open the carrying case. Then you have to carefully listen and follow the AED instructions.
Press pads firmly to patient's bare chest.
AED will instruct you to apply the pads on the patient's bare chest at specified position. Some AED may have adult and pediatric pads. Adult pads should be used for those who are 8 years or older. Peel the packing away from an AED pads. Attach the adhesive AED pads to the victim's bare chest. Attach one pad on the victim's right chest below the collarbone. Place the other pad on the side of the left nipple. In children, AED pads may be applied in antero-posterior direction also. Attach an AED connecting cable to an AED box. Some are pre-connected. When AED prompts you, clear the victim during analysis. Be sure no one is touching the victim, not even the rescuer in charge of giving breaths. The AED takes 5 to 15 seconds to analyze the rhythm and assesses whether shock is needed or not. If shock is advised, an AED would also prompt you to clear the victim. Speak clearly and loudly, clear the victim, and look to be sure no one is in contact with the victim before pressing the shock button. The shock will produce a sudden contraction of the victim's muscles. Immediately after delivering shock, resume CPR starting from chest compressions. You should not remove the AED or turn it off.
Analyzing heart rhythm.
The AED analyzes the rhythm once in every 2 minutes. If no shock advised, resume CPR immediately beginning with chest compressions. Continue until ALS providers take over or the victim begins to breathe, move or react. There are certain special situations that may require the rescuer to take additional actions when using an AED. These situations include hair on the chest of the victim, water or sweat on the chest of the victim, a victim lying in water, small puddle or snow, and a victim with implanted pacemaker. Additional actions required in these situations have been described in detail in your BLS manual.